with yellowing of the eyes, but a person also can have fever, fatigue, loss of appetite, nausea, vomiting, joint pain, abdominal pain, and even a change in the color of urine where the urine is dark. The acute symptoms of hepatitis B are different according to what age the person is. So children under the age of 5 are usually without symptoms, but for ages 5 and older, about 30 to 50% of people do have symptoms. Chronic symptoms of hepatitis B could be asymptomatic, but people can actually go on to have worsening illnesses such as cirrhosis or cancer without symptoms. So what are some of our complications of hepatitis B infection? A very small percentage of people have an overwhelming infection when they first get the virus and can go on to have what we call fulminant hepatitis. That's about in the 1 to 2% range. Many of those people need hospitalization. Other people have chronic changes to their liver called cirrhosis. Some could go on to have hepatocellular carcinoma, and some people actually die from hepatitis B infection. So acute hepatitis B virus infection, that would be a new infection, and those infection rates are highest in adults, especially males between ages 25 and 44. The symptoms can begin about 90 days after exposure, and those symptoms typically are going to last for several weeks. They could be asymptomatic, they could have mild disease, but they also, that 1 to 2%, can have fulminant hepatitis. This viral illness, hepatitis B, is more severe in adults over the age of 60, and as we said before, a small percentage of acute hepatitis B cases can end in death. Chronic hepatitis B infection, which is a long-term infection, can develop in children who have hepatitis B, and they are going to have a shortened lifespan and end up dying prematurely. Our young children and infants are at highest risk for developing chronic infection. 90% of our infants who haven't received vaccination can go on to develop chronic infection. 25 to 50% of children ages 1 to 5, and again we're speaking without vaccination, can develop chronic infection. If a person does have hepatitis B infection, they are placed on antiviral drugs and they will require lifelong monitoring to prevent disease progression. Okay, I had to have a quick water break. Okay, so now let's look at our graphs to see what's the difference between acute infection and chronic infection in terms of age differences. If we look on the left, and I hope this doesn't sound right, but I always look at things in terms of pediatrics. So if we look at our graph on the left for our perinatal, about 4% of them are going to have infection. 4% of children, our next largest slice is going to be our adolescent, and the largest is going to be 84% of adults having acute infection. When we look at our pie chart on the right, again, we look at our children, they are 12%, our perinatal is 24%, our adolescents are 6%, and the amount of adults having chronic infection now is down to 58%. So why do we want, as pediatric proponents of health, why do we want to talk about hepatitis B? It's so important for us to talk about perinatal hepatitis B because that is what occurs if an infected mom passes this infection to a newborn baby while giving birth. And again, 40% of those infants that are born to moms who may not know they have the illness will develop chronic hepatitis B infection. Perinatal transmission of hepatitis B accounts for 1/3 of chronic infections around the world. So in order for us to protect our infants from hepatitis B, CDC has a recommendation that all delivery hospitals institute standing orders and protocols to make sure that all healthcare professionals do the following. We want to make sure that we give hepatitis B vaccine to all newborns before they're discharged from the hospital, and it's really imperative that we identify all infants born to moms who are hepatitis B surface antigen positive, and we have to know if there are moms who deliver with unknown hepatitis B surface antigen status. In those scenarios, we're going to do two things, both of which have to happen within 12 hours of birth. We have to administer hepatitis B immune globulin, sometimes that's abbreviated HBIG, and we're going to administer hepatitis B vaccine. They're going to be done within 12 hours. Those injections are going to be in separate sites, but this must happen within 12 hours of birth. So why do we want to vaccinate at birth? We really want to prevent infants from acquiring this infection, and we know that up to 95% of those perinatal infections can be prevented if we act within the first 12 hours of birth. Our hepatitis B vaccine is one of the most effective vaccines, even in infants born to highly infectious moms, and they're protected in 70 to 95% of cases. So we want to save lives. That's why we want to do it. So again, how to prevent it? Prevention of perinatal hepatitis B infection starts with treatment within 12 hours of birth. HB and hepatitis B are given at different sites. We want to make sure that the complete series of 3 hepatitis B vaccines is completed at 6 months of age. And then we want to make sure that we, as primary care providers, are testing for a response to the vaccine, and that testing should be done ideally at 9 months of age. Now here's a slide from the CDC that is going to help us go through a flow chart of how perinatal providers test for hepatitis B infection. So they're going to routinely test all women in every pregnancy for hepatitis B surface antigen. They're going to test in the first trimester if possible, and they are going to test regarding of what any past hepatitis B status was. If we look to the left, if a mom is hepatitis B surface antigen positive, we're going to make sure those results are reported to public health departments. We're going to make sure a copy of that lab report with the mother's status is communicated to the hospital where delivery is planned. We want to make sure that the infant's newborn chart is going to have that information. We're going to identify the future pediatric provider if we know them, and we want to really make sure that the delivery hospital knows this information goes in 2 places, mother's chart and infant's chart. We're going to make sure that the mom is aware of what her status is. We're going to give a card to her that's going to note her status. Why do we want to do that? Well, we know in many situations moms get their prenatal care done early. They follow through for all of their appointments. But let's just say, in the very last 4 weeks before birth is planned, mom is out and about, social event, oh my gosh, goes into labor and ends up delivering at a hospital unknown to her. If we have instructed the mom and given her a card that speaks of her hepatitis B status, then the new delivery hospital will know that they have a 12-hour window to act. We want to make sure women understand that they have to educate all contacts, household contacts, sexual contacts, and any possible needle sharing contacts, that they know her hepatitis B status so that they can have testing and they can take care of their health by seeing a hepatologist, GI doctor, and getting their hepatitis B vaccines. So that was the left side that talks about a surface antigen positive mom. Now let's look at a mom who's been tested in the first trimester and she is surface antigen negative. Well, we still want to make sure that that information is communicated to the parent that she knows, but most prenatal providers are screening throughout pregnancy. So if the mom acquired a new sex partner or had an STD or has a history of injection drug use or notifies the prenatal provider that their partner is hepatitis surface antigen positive, that we would have to do a hepatitis vaccine series and retest. Okay? This is a slide that reminds everyone women are going to be screened, and it lists the name of different labs, ARUP laboratories, LabCorp. I'm ordering the correct panel. So if you need this slide, it will be available on www.cdc.gov/hepatitis. Now let's look at another slide with a surface antigen positive. We're going to say this is a perfect world. She's delivering where she planned to deliver. They have the note in her chart. They already have the note in the infant's chart. The nursery staff has been alerted, and everyone knows and carries out the plan to give both hepatitis B and HB to the infant within 12 hours of birth. We also want to make sure this information is in the infant's chart so that the future pediatric provider will know what to do. We also want to make sure that this birth has been, information has been sent to the public health department because they play a very vital role in ensuring that the infant gets care in a timely fashion and reminds people to do the testing. And we want to make sure that we are placing the results in the vaccine registry. Now we have a little caveat, and it has to do with what the infant's birth weight is. So for this first scenario, we're going to assume that our infant is above 2,000 grams and that it's really okay for us to give that HB and hepatitis B immediately. Now we have another scenario that our mom presented, and at the time of delivery, it's known that she's surface antigen positive. If the prenatal provider has checked for risk factors and there are no risk factors, then it is okay for us to give the first dose of hepatitis B at birth, and copies of information have been placed in the chart. If, however, there were new risk factors that came up, then the mother would be retested at birth. If those results are not immediately available, then our infant will get HB and hepatitis B within 12 hours. Now, here's our final CDC slide that tells us what to do if we don't have antigen testing at admission to the hospital and we weren't able to retest at delivery. So basically, you're going to kind of think the worst. The mom presents for whatever reason with a status unknown. If the baby is less than 2,000 grams, we're going to give the first dose of hepatitis B and HB within 12 hours. And then we do test our mom. If we find out that mom was surface antigen negative, we're going to follow our recommended schedule. If we find out that mom was surface antigen positive, again, we do have to tell the public health department and the pediatric provider. Okay, let's say we have a scenario where we gave the first dose because we were unsure, and then after we do testing, that we find out mom is positive. We've got this little caveat of if they're less than 2,000 grams or above. If they're less than 2,000 grams, we're going to give HB and hepatitis B, but that birth dose doesn't count for our series. That little infant will get a series of 4, but still important that we give that first one within the first 12 hours. We are always making sure that the parent and mom and dad, receive a copy of the baby's immunization record. Here in the state of Illinois, we have eye care registry, and we want to make sure that what was done in the hospital is placed in eye care registry, and we want to make sure that the family understands that the infant is supposed to come and get all vaccines, especially hepatitis B, on a timely basis. So, the state of Illinois has mandates for hepatitis B prevention for daycare as well as grades kindergarten through 12th grade. We have a statewide mandate in Illinois for hepatitis B vaccine, and that mandate is for daycare, elementary, middle school, and it went into effect way back in 1997. All 50 states in the United States have hepatitis B prevention mandate for daycare and also for kindergarten through age 12. This might seem to be a very busy slide, but just take a breath and remember today we're only looking at the very first vaccine at the top, and that's our hepatitis B. I bring your attention to us wanting to give the birth dose before they leave the hospital. Our next two bars are, say, 1 month and 2 months, and that means that providers have permission to give the second dose between 1 month and 2 months of age. I now bring your attention to the next yellow bar that goes from 6 months to 18 months, and that means that pediatric providers have permission to do that vaccine within that time span. However, if we know there is a problem with hepatitis B exposure and an infant received HB, our goal is to give it at birth, 1 month, and 6 months. Okay? We have slightly different rules because we really want to make sure that our infant doesn't have a problem going on to get chronic infection. So before we had vaccine, there were an estimated 300,000 persons who were infected annually in the U.S., and 24,000 of those were infants and children. But since we've done hepatitis B vaccine at birth, our rates of acute infection have declined by about 82% since 1991. So when we look at the year 2010, we only have reports of 3,374 cases of acute infection, and that's really, really significant. Now I want to remind everyone what kinds of vaccines we have. Hepatitis B vaccine is manufactured as a single agent vaccine or as a combination vaccine option. It's given for our infants, children, and adolescents in a 3-dose series. We want to remind everyone that you don't need booster doses, and it's estimated that the duration of immunity is about 20 plus years. Hepatitis B is given as an intramuscular vaccine, and we do have permission that we can use different manufacturers. The manufacturer that's given at birth doesn't have to be the same manufacturer for the final 2 in the series. We want to make sure that all hepatitis B vaccines are stored in the refrigerator, and we do not freeze hepatitis B vaccines. Our single agent vaccines protect only against hepatitis B, and the 2 vaccines we have available in the U.S. are Recombivax hepatitis B and Injurix hepatitis B. We remind you that only the single agent vaccine can be given at birth. These single agent vaccines can be given to our adolescents and adults as well. Now, just a reminder, we do have combination vaccines that protect against multiple diseases, including hepatitis B, but none of these combination vaccines can be given at birth. Our first combo listed is ComVax, which is hepatitis B plus Haemophilus influenza type B. The youngest age that we can use this Comvax vaccine is 6 months, and the oldest age is 71 months. We also have a combination vaccine called Pediarix, which is hepatitis B, diphtheria, tetanus, acellular pertussis adsorbed, and inactivated polio. So Hep B, DTaP, and IPV. That minimum age, once again, is 6 weeks, and the maximum age is 7 years. Now this Twinrix, because I'm a pediatrician, I kind of pretend that this is, this is not in my world because I don't see many people above age 18. But for those of you who are family medicine providers, Twinrix is Hep B and Hep A and can only be given in adults greater than the age of 18. Again, our preterm infants, the ones who weigh less than 2,000 grams, do get a birth dose of hepatitis B and HB if the mother is hepatitis B surface antigen positive. We already know if you weigh less than 2,000 grams, you have a decreased response to vaccines. So if we have excellent documentation that the mother is surface antigen negative, we do have permission to delay the first dose of hepatitis B until the infant is 1 month of age and has a better immune response to vaccine. This is a reminder slide that says dose number 1 is a single agent dose and is given before they leave the hospital. There's a minimum of 28 days between the first dose and the second dose. And as a reminder, we do have permission to give the second dose between 1 month and 2 months of age. There has to be a minimum of 16 weeks between the first dose and the third dose, and there has to be a minimum of 8 weeks between the second dose and the third dose. Please remember that the final dose cannot be given earlier than 24 weeks because if it's given, it's considered invalid, and then there'd have to be a 4th dose. So if you have an infant who only got 1 dose or 2 doses and they're missing something, then it's okay to use the catch-up schedule to give the final hepatitis vaccine. And it is really okay to integrate, let's say if someone came from another country and hasn't had any vaccines, it's okay to integrate catch-up vaccines for hepatitis into an adolescent immunization schedule. So let's say that you meet an adolescent who is above the age of 11 and for whatever reason they never had hepatitis B. You do have permission to use a different type of single agent hepatitis B. It's a larger dose. It's a 1 milliliter or 10 microgram dose of Recombivax, and you do have permission to use that as long as you observe the interval between 4 and 6 months between dose 1 and the final dose. This only applies to Recombivax, and we really want to make sure that you're aware that Recombivax comes in this larger dose, 1.0 milliliters, 10 micrograms, which is different than the pediatric dose. I'm going to take just a moment and describe a clinical scenario that I know would never happen in your office, but I just want to bring it up. Everyone in your office who provides vaccines should take a little field trip to your refrigerator and make sure that you are aware of every single vaccine that is in your refrigerator. We really want to make sure that you have somewhere a scenario and you've received training that you remember which doses are pediatric and which doses are adolescent, because I had a family come to me that had lost confidence in another pediatric provider because they found out that their 4-month-old infant was given Recombivax that was really lot number proved it was supposed to be an adolescent vaccine. So I know that wouldn't happen to you, but I want to make sure that everyone gets training, everyone is aware of what's going on and how many vaccines are stored in your refrigerator so that errors like this do not happen. This slide just reminds us that there are single antigen vaccines and that we need to know which ones we have. So we look for our infants and children, and we see for our micrograms for infants and children, it's 5 micrograms. We see that Recombivax does have one for ages 11 to 19, and that's 10 micrograms. If you're taking care of adults greater than the age of 20, they all receive 10 micrograms. And if there are special scenarios for people who are on hemodialysis or the immunocompromised, you really want to make sure that you sort out by age if they're greater than or less than 20 to give the correct dose. The next column talks about Injurix and which dose is used. And then over to the right in the green, it reminds us to look at Convax and Pediarix and really understand what is in each vaccine. So what kinds of vaccine reactions are we going to counsel families about? I remind you that every family that receives a vaccine is receiving an up-to-date vaccine information statement. So I like to use the vaccine information statement and hand it to the family as I'm describing side effects. So yes, there is going to be pain or soreness at the injection site. There are a few complaints of fatigue or headache, very few complaints of fever greater than 99.8, and systemic reactions are extremely rare. So for hepatitis B, if there has been a severe allergic reaction to a previous dose or a vaccine component, that's a contraindication. Precautions mean when we do our screening questionnaire, we're going to ascertain if our infant or toddler or child has moderate or severe acute illness with or without fever, and you may defer vaccines if they're acutely ill. We want to make sure that we're double checking our infant's weights because we won't give it if they weigh less than 2,000 grams. Thank you very much to everyone for taking time from your busy day, and I can answer questions now. Just go ahead and type them in. Okay, so far no questions, so I have a little comment. I want to remind everyone who's healthcare providers that we all should have received hepatitis B vaccinations. I want to make sure that everyone keeps a copy of their own immunizations. So I want to remind our healthcare providers that all of us are supposed to know our hepatitis B status. We're supposed to receive annual influenza vaccines, and we all should have received Tdap vaccines as well. Please make sure you know where your vaccine information is. If you don't know, please research it and have that available.
We're getting some questions. So first one is, after 20 years, are people no longer immune?
Well, that's a good question. After 20 years of age, I guess I want to go back and think about the history of hepatitis B. If a lot of people started receiving their hepatitis B vaccines when they were infants in about the mid-1990s, when they're old enough and meet other people and are now engaging in intimate relationships, hopefully everyone all is hepatitis B immune. I have not had a scenario, and I tried to look it up before the talk, that a person would have to repeat the hepatitis series. So one source said that your immunity lasts 24 years. Another one says it lasts at least 20 years. Every year, physicians double check recommendations from a group called the Advisory Committee on Immunization Practices, and so far they have not said that we adults who are past 20 years need to have boosters. So that's something that you'll recheck with your doctor every year, and if the recommendation changes, then everybody would be notified to get a booster. But thank you, that's a very good question.
Okay, and another question is, of all the immunizations, why is Hep B the only one recommended to be given at birth?
Thank you very much for that question. Hepatitis B is recommended to be given at birth because we really want to prevent any inadvertent passing of hepatitis B infection at birth. In an ideal world, moms are tested in the first trimester and they would not have any risk factors of someone inadvertently giving them hepatitis B virus during their pregnancy. In an ideal world, a mom would not be exposed to any IV drugs. She wouldn't have to worry about her partner accidentally giving that. But we kind of know we don't live in an ideal world. So a mom may think she doesn't have risk factors, but then find out later that she did. And if she has the virus and didn't know it, it could be passed at birth. So because we want to eliminate all perinatal infections, that's why that's the only one that we give at birth.
Okay, and the last one so far is, what is recommended if a titer is negative? Should clients have the series repeated?
Okay. So let's say we have a scenario. I'll just give an example of a patient that I cared for in the past. It was a little baby born to a mother that was surface antigen positive. The baby got HB at birth and hepatitis B at birth and got all 3 vaccines exactly on time by 6 months of age. The health department sent me a letter to remind me, hey, remember, your patient was born to a surface antigen positive mother. Please do antibody testing. So we did antibody testing and they sent me information about what to do with the results. And this little baby did not show any protective antibody titers at that blood work that was done at 9 months of age. So I reached out to my infectious disease consultants and I was told that the infant needed to repeat the series of 3 hepatitis B over a second 6 months time span, and that after that we consider that that infant is protected. And so if an adult has a negative titer after the series of 3, I would advise them to talk to their primary physician to find out if in adult land, if they want them to have the series repeated. I did a talk earlier and I actually met a woman who revealed to me that she was a non-converter, and this happened several years ago, and she got 3 sets of 3, and after testing, she still was a non-converter. But again, I advise you to talk to your primary care doctor who will talk to their infectious disease consultant and then double check and make sure, that they're up to date on the newest guidelines.
Okay, so we've finished up with the questions so far, but we still have a bit of time. So if anybody has some burning question that they really want to get answered, definitely type them in. I'll give about another minute or so for that. And otherwise, if we don't have any more questions, we'll go ahead and wrap up the webinar.
Okay, I just want to offer to everyone information about my favorite sources to look up information about immunizations. Immunization Action Coalition sponsors a website, immunize.org, and they have the most up-to-date schedules for infants, children, adolescents, and adults. They have a copy of standing orders. They have the most up-to-date versions of the vaccine information statements. They have another section that is my favorite, and it's called Ask the Experts. And if you have a question about a vaccine or a particular illness, you go to that section under Ask the Experts, and they just have just a wealth of information about anything you need. So again, it is immunize.org, and it's great for schedules, and and how to keep up to date with your vaccine information statements.
Okay, so it looks like nobody has any more questions that they have at the time, but of course, if anybody does have any questions in the future, oh wait, one just came in. So what is recommended for adults going to school and requiring a titer? How true is it that they get one Hep B shot before the titer to show them being positive? Is this correct to do?
So we have an adult that's going to return to school, and the school is requiring a titer. I had a scenario in medical school. We had to receive all of our hepatitis B vaccines, but there was one hospital that if we went to go there for educational experience, we couldn't go without showing a titer. So I recommend that all adults have their actual vaccine record, and if a titer is asked for hepatitis B, that you have to have the titer. So our second part of the question is, how true is it if they get one Hep B shot before the titer to show them being positive? I'm not quite sure I understand that part of the question. If you can type in a clarification of what you mean, because I'm not quite sure I understand that question. Do we have your email address of the question? I mean, if we're done and they have a question, can we give your email?
Yeah,
and then that way
I will be sending everybody after this webinar a link to the video and the PDF of the PowerPoint slides. So
I'm sorry I don't have the answer to part 2 of that final question. If you be kind enough to email that to us, I will research that and get the answer for you. I was told they only needed one shot before the titer in order to wake up immunity. Ooh, boy, I think we need a phone call. I'd be happy to answer this question because the scenario that is being presented sounds a little bit different than anything that I was told. But again, I'll be happy to research that for you. Just go ahead and email us and we will get in contact with you.
Oh, and looks like another question also came in. It says, after the second hepatitis B series, if the child should have the second serology, if the result is still negative, client should be referred to the hematologist.
Okay, so in the scenario, let's say the infant is born to the surface antigen positive mother. They got HB at birth, first hepatitis B within 12 hours. They got the series done within the first 6 months. They got the titer drawn, they were negative. They got the second scenario of 3. And if you are going to test after the second set of shots and those results don't make sense to you, remember that the public health department is partnering with you. They are following this child with you, and you also are partnering with your infectious disease consultant. And, you know, it's like a shared decision. If your infectious disease consultant says after they've had 2 rounds, it's okay to stop, that you're going to make sure that that information is conveyed to the family and that that information also is available to the health department. So at this point, I wouldn't be referring to a hematologist because for me, this is something that the Department of Health aids me with and my infectious disease consultant.
All right, so it looks like we've got all the questions answered, so I'm going to go ahead and wrap up the webinar. So once again, I just wanted to thank everyone for joining us on today's webinar on hepatitis B, and another thank you to Dr. Pierce for the wonderful and informative speech.
My pleasure.
It's always great to have you, Dr. Pierce. So I just wanted to remind everyone again that before the end of business day today, you will be receiving a link to the recording of today's webinar, as well as the PDF of today's PowerPoint slides, and also a link to the evaluation. Everyone will have 2 weeks to complete the evaluation, and after that, the evaluation will be closed. And then 2 weeks after that, everybody should expect to receive an electronic copy of their CE certificate. So we hope that everyone enjoyed the webinar and that you guys will join us for our future webinars. Thank you very much to everyone.